Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be doing a 2025 year in review. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 20 years of health IT content at healthcareittoday.com. 20 years, Colin. It just makes me feel old.
You have been doing this a long time, my friend, a long time.
Yeah, I think when this publishes, it will be right at the 20-year anniversary of the very first blog post that I'm embarrassed to look at. But
I think we're all like that when we look back on our first X, right? Like our first videos, our first podcasts, our first blogs. Yeah, it just shows you're evolving.
Well, I mean, what's embarrassing is I was just thinking out loud, like, hey, I'm starting this blog and I'm going to talk about health IT and the things I learned. Like there was no good content or anything. It was just like, hey, let me think out loud. Like, which, someone described healthcare IT today that way one time. They were like, John, it's kind of like you musing in public. And I'm like, oh, well, yeah, that kind of is true.
All right. Yeah. So this is a year in review. Can't believe we're already here, but it's going to be fun. It's always fun to do these little mini recap ones. Um, but yeah, sorry, John. Yeah, so John, what were your top changes, trends, or innovations that you saw this past year?
you know, it it would be impossible to not say AI. Like AI was, is, and probably will be the biggest trend for a while, that was happening. But I think 2025 was super interesting for AI in healthcare because as we got to the latter half of 2025, you started to see like the hints of skepticism, at least I did, from a lot of CIOs that are like, yeah, we see the potential. We know we have to be involved in AI, and we know that AI is going to transform so many things that we're doing. But they're like, are the solutions really ready for us? I think the AI medical scribe has been implemented that way in the ambient solutions, and they are going full bore on that. And we're seeing it a few other places, Epic's art in basket stuff, right? That's really taken off. We see a bunch in the RCM space where AI is being doing well. Even the chatbots for patients, we see a lot of action there and maturity. But when it comes to a lot of things, they're like, I'm not sure we're quite ready for prime time, or we're not quite ready to do this at enterprise scale yet. So I'd say AI is the biggest trend by far in 2025. But I think we're starting to see that skepticism to say, hey, we need to mature this a little bit more. And the hallucinations really do worry us. Like we're not ready for that, And so I think we're seeing a little bit of pullback from the AI trend.
Yeah, I mean, it's hard to argue with you. AI continues to be the trend. It's been the trend for the last 3 years, I think, that we've been covering it. It is definitely it continues to be the hot topic. I'm with you in the sense that um, AI Scribe has quickly faded into the background, meaning I think people just accept that it's good, it works, it's better than what we have, which is manual, right?
Mhm.
Documentation. So even if the doc has to correct it, it's still better, right?
Yeah,
Um,
and it might be more of a feature.
yeah, and that was where I was going with this is to say, it's surprising how quickly it's been accepted, and I think generally everyone's very positive on the results of it. But where it's interesting was I think even last year late, there was still a lot of talk about people implementing AI as a separate thing. Like, hey, we're gonna deploy our own LLM, we're gonna build our own little engine, or maybe adopt it from someone else, and we're gonna build our version of an AI for our organization. And you name the organization, like a provider, a payer, a health IT company. But as this year has gone on, what I'm seeing a trend around is actually not a lot of people have ended up doing that. Either it's because it was too hard or too expensive. They're essentially relying on their vendors to go, I'm just going to wait until you embed it. So, hey Oracle or hey Epic or hey, our PAX system. Whatever you've implemented as your AI, will choose or not whether to use it. But I'm glad you're doing it because I'm not going to put my own layer on top of it, right? Like everyone just seems to be waiting now for whatever the vendors are doing and kind of taking it from there rather than trying to implement their own. Because I remember last year at the end, I still was hearing CIOs talk about this. So to me, that was the biggest trend is that no one's implementing AI on its own anymore, except in research. That's the only place where I hear about that.
Yeah, it is a good question. And we do see that trend. They look to the vendors. They want the vendors to do it. That's not going to change and probably will happen for most. It'll be interesting to see, do we see a lot of innovation from provider organizations that they say, oh yeah, we should own this. And the only place we do see it a little bit is kind of like a HIPAA compliant ChatGPT large language. We see a few people doing that, but you're right. Beyond that, we're not really seeing it.
Yeah. The other trend for me is actually multi-agent, multi-AI, multiple AI agents. So that sort of agentic AI world starting to crop up, right? So now I'm starting to see, hey, here's the AI that can handle chats on the web. And then here's an AI that can handle calls. And here's an AI that will help someone navigate on the website. Like they're very, very specific now versus before. I think there was a vision of maybe just having one AI to do everything. But now what I'm hearing and what I'm seeing is that no, it's actually better to have a very, very hyper focused AI agent than having another AI maybe manage all those agents, right? I heard the folks at League talk about this, and I've heard people at Epic and Oracle and and of course NextGen and ECW. They all talk about it like this now. So that to me is a growing trend, and whether you call that agentic AI or whether you call that multi-agent AI management, whatever you call it, there's lots of AI agents hanging out there now and doing things.
Yeah, well, and I think we'll continue to see it evolve. What's interesting, I saw a venture capitalist write about AI, and he said there's kind of four stages. He's like the basic stuff that's like no frills, RCM, not clinical, anything like that, right? I thought that was interesting. Like the second one is like kind of the co-pilot, right? That's where we see a lot of the solutions today. I'm enhancing the work that the doctor does. And then he had like a third and fourth stage, which is like, hey, kind of supervised, like it's automated, but it's supervised by someone. And then all the way up to, the tie end, which is like fully automated, not reviewed. And he pointed out something really interesting, which is many of our regulations don't even allow stage 3 and stage 4 as he described it. And so it's like we need some policy stuff to happen if we were going to make that happen for him as well. So anyway, I think it's going to be interesting to see it continue to evolve. The other trend that definitely was happening in 2025, and especially the tail end, the second half, is everything about cost cutting. Every organization, CIOs in particular, are being told, hey, guess what? You're not going to have as much money as you had before, or at least we're flat, And so a lot of the projects you want to work on, guess what? You're not working on them. Like, sure, we're maintaining the status quo and whatnot, but man, they've been hit by a reimbursement. They've been hit by higher supply costs. They've been hit by higher staffing costs. They've been hit with even lower reimbursement, for, especially in areas where immigration is an issue and they're not being reimbursed for different patients that were coming before. So I mean, there's just this wide variety of cost pressures happening on every organization, and I think that's going to continue for a while. But we certainly saw that in the IT side. If you don't have a message of how you're going to cut costs, guess what? You probably aren't going to get a big sell unless you're an AI medical scribe, maybe.
We'll see if that's a trend for 2026. But John, was there a news item last year or this past year that really stood out to you, or an event that stood out to you?
Yeah, I'd say the biggest thing for me was all the government stuff. And we knew that was going to kind of come. Like Trump was going to do some initial stuff, but we knew it would take like a year or so to really see what would happen and what they were doing. And so I mean, the government efforts around CMS qualified networks and kind of this CMS health tech ecosystem, as they're calling it, that whole effort, Amy Gleason and the team at CMS are really pushing forward. The kill the clipboard, it's funny they want to kill everything, but it's true. We do want to kill the clipboard. I don't think anyone wants to fill out a paper form ever again. I can't imagine. So I mean, but all of those efforts to push it forward, to innovate, to push forward information sharing, making information blocking like more damaging, if you will, to do
Mm.
it. Like that is interesting as well. And then the most recent one, the access model, really pushing forward value-based care and saying, we're going to pay you not just on the results you do, but actually encouraging you to do things that could improve the wellness of the patients. So, I'd say those government efforts for me were the biggest news item and an event in 2025.
Yeah, hard to argue. I mean, the info blocking was definitely on my list of top things that happened in 2025. And even though I think you could argue whether or not it has teeth or whatever, it was significant in the sense of, hey, there's some guidance coming out here, and they're serious about this. And so, to like your point, I think it showed the seriousness of some of the efforts that they're putting forward. And the fact that it has gone through relatively, I'll call it unscathed in the sense of there's not a lot of debate about it, shows to me it actually is pretty bipartisan. Like there's support for this stuff because it makes sense, right? So I think that is certainly big news. The other big news items for me actually were all centered around the EHR companies, funny enough. And I did have a chance to go to a lot of these user conferences from them, so that's why I think they're on the list. But some of the big news items for me was Oracle's new, completely from the ground up rebuilt EHR. I'd heard about this last year. It was just sort of a concept at that point. This year, real users were using it. It is pretty awesome. It is built entirely on Oracle's tech stack now. It leverages Oracle's AI. It is kind of a rethink of the whole user interface because it's just basically like a Google bar, right? You type into it, you ask it questions, it gives you answers. It is pretty incredible. Whether or not it gets accepted, that's a different story. But definitely for me, that was some big news. And the other big news from the other EHR companies is, of course, Sri Velamur being named president over at NextGen, and then Richard Adkin coming back as the head of Greenway. So we had some changes at the top of some of these EHR companies. So to me, those were some of the news stories that certainly caught my attention in 2025.
I'd say that's the big one for me too. Like, it's just the breadth of announcements that you heard from every health IT company. And I think it is attributed to AI and what it makes possible and what it makes available to these companies. But that is a big storyline that all of these kind of, I don't want to describe them this way, but man, I'm going to like the zombie health IT companies that had always done the same thing that they were doing for the same thing, solving the same problem forever. Now they were like, hey, let's actually innovate and let's leverage AI and the opportunity that it presents to do something more innovative. And so I think as a broader perspective, that was a huge news thing too, is that the innovation that's happening with a lot of these companies is just so much further along than what we would have had a year or 2 years ago.
Yeah, and it's interesting you say that because the other news item for me that stood out was the fact that we didn't actually have as many startup stories, at least for me. Like we know Ambience, we know some of those stories, like in the AI space. Certainly there was news there, but I didn't hear of a lot of other startups in the health IT space this year that really were the up and coming in other fields, whether that was RCM or patient experience or even interoperability. Usually every year there's like two or three companies that kind of emerge from each one of those areas. I didn't hear of a single one. Now, maybe I wasn't looking for it as hard, but so admittedly, if you're out there listening to this and you are one, sorry. But yeah, I just didn't see that level of innovation. It was more of the people who had been in the business for a while, like the EHR companies and the existing players. They were pushing the innovation agenda more this year than ever before, in my mind.
Yeah, the only exceptions is like the open evidence, the Hippocratic AI, right? It's all in the AI space. If they've launched, can you imagine launching a health IT company that doesn't leverage AI today? It's like saying, we did this, and man, it's amazing how history rhymes, right? Like we had the same experience with cloud. Like no one 5 years ago and even today, would launch a startup saying, "Hey, we're going to be an on-premise client server." Like that just doesn't even exist, right? You're of course you're going to be in the cloud and you're going to provide a cloud solution, right? And so the same thing is kind of happening today with startups. Like you wouldn't launch a company that didn't include some sort of AI. So but we did see from Hippocratic AI and Open Evidence and some of these. It's funny because we almost don't consider them startups because they raise so much freaking money. That you're like, oh, are you considered a startup if you raise 100 million? I don't know. That feels different, right?
Although I will say this, John, I hope there aren't many startups that have launched with a vibe coded product because we're starting to see some of the horror stories around things that were vibe coded and failing under load. So anyway, that's a story for another time.
Yeah.
And hey, if you're just tuning in to this episode, you're listening to Healthcare IT Today with John Lynn and myself, Colin Hung. Today, we're going over a number of hot topics that happened in 2025, some of the hot stories, some of the news items, and we're just doing our year in review. So John, this is a fun one. Was there a story or something in 2025 that surprised you?
I'd say the biggest surprise for me had to be the number of lawsuits. And it's interesting that how many organizations are going the legal route rather than the regulatory route or rather than, some of those ways. And we see that the biggest one is information blocking. You could go to OCR, you could you could do file reports and complaints, the FTC, whatever. There's all sorts of oversight from the government. They're not doing that. They're going the legal route, and that's been really fascinating to watch. Our buddy Brendan Keeler's covered a lot of it, which is interesting because he's not a lawyer, but he's reading up a lot on what's happening there. So to me, those lawsuits were the biggest surprise, and the number of them, and the depth of what's happening and what we're seeing and what's coming out of that is just it really is the essentially the soap opera of health IT in some ways, right? Of what's happening because it's just really interesting to see how that plays out. So I would throw those in there, of course. The Epic antitrust lawsuit, is interesting. I think it's the wrong defendant. I think there have more coming, so it'll be interesting to see how Epic replies to that. And not necessarily the lawsuit itself, but we've already seen Epic change some of the things they do and the way they're approaching it. And so, I think, and not just Epic, right? Every health IT vendor has had to say, am I information blocking? And I need to maybe change how I'm approaching it. So to me, that was the biggest surprise to me. I didn't expect this many lawsuits and the legal route to have such an impact on what's happening in health IT.
That's a good point. I mean, does that speak in some way to the lack of consequence through the other channels, right? Because I certainly think the legal route is longer than if you went through the existing channels. But, the existing channels don't have a lot of penalties. They don't have a lot of ramifications for the offender. And so maybe the lawsuits was the only, it was the
Well, it's
only way
hard
to
too
do that.
because if you sue someone, they probably don't want to be your partner after you sue them. Like that's
That's probably true.
that's why
That's very,
legal
very
doesn't
true.
happen a lot of times, right? You're like, wait, I need to keep working with them and I need their EHR data or whatever their data. So I don't know how that plays out, to be frank.
Well, to me, there were two really big stories that caught me by surprise because I was expecting neither of them. And number one is the acquisition of Kairos. I did not see that coming. I mean, in the sense of I knew M&As are always going to happen in 2025, but that one in particular I didn't see coming. And the other one, which is just because of the size and the significance of it, the acquisition of Press Ganey by Qualtrics. Now that one's still pending. I think I don't know if it's official yet or not. I haven't looked it up, but those two acquisitions came out of nowhere for me. I wasn't even remotely aware that those two companies were shopping themselves around or were interested in doing that. So, and then just in even besides that, just the significance of those players in those spaces. Those were pretty major acquisitions. Kairos by a company that didn't have anything in that area. And of course, Press Ganey and Qualtrics being two of the titans in this area that they are competing in. So those were two big news stories for me.
Yeah. Well, and what's interesting about those is once you saw them, you're like, oh, actually, like Qualtrics having Press Ganey, that kind of makes sense. And then when you look at the data and everything that's happening with AI and data, you're like, it makes even more sense, right? Like that gives them the data that they need to be able to do some really cool things. So that's interesting. Yeah, I mean, we saw another one, Evidion and Tiger Connect, right? Another bit of a surprise, right? Like but then you start looking at it, you're like, oh, actually, it makes sense, right? Like Tiger Connects does the communications, and the smart hospital rooms of Evidion are a way to facilitate that communication with the patient and with the caregivers. So it's like it makes sense when you start seeing it put together. But you're right, it wasn't on face something you're like, oh yeah, these two are going to be together for sure. So it was, and it was less. Vertical integration and more horizontal integration with many of these acquisitions, which is why they're probably more surprising than some of the others.
Can we go with a not a surprise, John?
Oh
I got
yeah,
one for
what was
you.
your not a surprise?
Yeah, so this is one that I'm glad wasn't a surprise this year, and that was Hims and Health and Vive under new management, right? Because the conferences are now owned by other companies. There wasn't a lot of big changes. Sure, there were some changes, there were some noticeable things, but generally, those two conferences were the same as they've always been, in the sense that, they had the DJs in the front, the vendors were still there. The turnout was what we kind of expected. In fact, I think it was a little bit better than what we thought it was going to be. So I'm just glad they didn't do too much to try to change those conferences overnight. So I'm glad that wasn't a surprise story of the year.
Well, and I would say that the competition has actually driven them to better levels and some things. Has created some interesting cost pressures that I think a lot of vendors have felt, as they try to produce a bigger show and things like that. The surprise was actually HIMSS, the association, actually, laying off a bunch of people. That was the bigger surprise. The conference seems to be doing well, but of course, that's new ownership. It's, related to the association. They're still involved with them, but, the association, having to lay off a bunch of people, that was a bit of a surprise. So, we'll see where that all heads and what that leads, where they take it from here. But yeah, I mean, it's interesting how many people don't realize that the conference is no longer owned by the association.
That's
So
right.
it'll be interesting to see how that plays out over the years.
Well, since we're on that topic, let's wrap up with this one, John. Was there a conference experience that stood out to you the most in 2025?
To be frank, it was actually a bit of a surprise that HIMSS was so successful. And, like I heard from many vendors that they're like, it's as good as it's ever been, other than the meaningful use days, which is, if you were an EHR vendor during the meaningful use days, that was another era, right? But, anyway, the way it came back and was so successful was, an amazing experience. And I think most of the people there were interested. I do think people are choosing smaller events for many things. So it's either really small or really big, right? Like that's what it seems like it's kind of played out is like, hey, I want the intimate one or I want the every vendor's there, like HIMSS and Health and Vive. And so it's like it's kind of bifurcated into like super large or super small. Like that seems where people have gone, which is kind of interesting. But I'd say the experience that stood out the most was the EHR user conferences. You already mentioned it, like the vibrancy of what's happening at every EHR user conference. And we've been to almost all of them. I think the only one we're missing is like Athena. So, but they don't allow press or something. I don't know. But, and ModMed we almost went to, but it didn't quite make it. But we went to pretty much all the rest of them, right? And the vibrancy, whether it was Meditech, whether it was Epic, you went to Greenway, Next Gen, and Oracle, right? Like they all have this energy about them that is like it's palpable because it's such an essential part of every organization. And so like what they announce is so impactful on what's happening with healthcare organizations. And then the users get so much value out of attending because they get to talk to peers, they get to talk to the programmers, they get to talk to the experts. So for sure, the user conference experience stood out to me in such a big way because it's such an integral part, which probably says something about the future of health IT and how dependent we are on EHR and how, how much impact that will have on the future of healthcare organizations.
Yeah, I'm with you there. The user conferences that we had a chance or that I had a chance to attend this year, I think were all excellent. They were all well run. Had great sessions, and you can see from a provider standpoint, it's easy to justify going, right? Like, hey, I'm going to send 3 or 4 people because I get a chance to sit down with the developers or get a solution to this problem or work out this report that I've been fussing with over the last week, and now I can get it done in a few hours just sitting with the support person right there. It's easy to justify. And I think actually that will play a significant part of 2026 because, they're not going to get the money and they probably don't get a lot of value. If you're every day working at Epic, you're probably not coming to HIMSS, right? But you'll definitely want to go to the Epic User Conference or you'll want to go to the ECW conference. And so, yeah, I have to give credit to those conferences. I mentioned Charmalot as well. It's a smaller one, but well attended. And to your point, people who were there were very excited about the announcements coming from the company. I also have to mention, Neshco was a really good conference for me. It was a smaller healthcare marketing one, but it was really interesting to see a lot of providers there, which was nice. And then, yeah, to your point, some of the larger ones, right? Like I just got back from RSNA, wonderful conference once again, lots of really interesting innovations on display. And then the big boys, like, the HIMSS and the Healths and the Vives, those were always fun because we get to see so many people and they're all very well run. So those were the conference experiences that stood out for me.
Well, and the thing that stands out is, and I think some conferences are finally starting to embrace this, that it really is about the people connecting with people. I heard someone complain about some event and they're like, they had so much programming that I couldn't connect with the people that were there. And I'm like, that's such a miss, right? And we see this more and more where conference organizers realize, hey, we need bigger break times so that you can connect with those that you want to connect with and you want to meet some people. And we need some facilitated networking too, because not everyone is as ambitious as others when it comes to going up to random strangers and introducing themselves, right? And so having those opportunities for facilitated networking and connection and opportunities to connect in different ways, I think that was probably the other thing that stood out is more and more of those opportunities that allow. And here, this one might be interesting for you. I saw more chairs than I've ever seen at any conference. And I don't know if there were just empty booths and so they had some space and they're like, let's put in some seating, or if it was like a plan by the conference organizers because they'd heard so much, there's nowhere to sit. But I've seen more chairs in like lounges, booth area, lounge areas, sitting areas, whatever, that were available at conferences than I've ever seen before, which I don't know, like, again, I don't know why they've chosen to do this, but man, it's great because we know how long standing on your feet for that long it can be. And it's really nice to have just a place to sit down and, catch up on some email for 10 minutes, in between, events or meetings or appointments. So anyway, that was a bit of a surprise. And it's nice that the conferences are embracing actually having somewhere for you to sit.
I totally agree with you with that one. I love the whole lounge areas and the meeting areas for both spontaneous meetings. Well, that wraps up our year-end review, John, and we're looking forward to a whole brand new one in 2026. So,
absolutely.
thank you to all of you who tuned in to this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com or on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.